This is one piece of the puzzle, but this is an important one. We have to stop the mass exodus to the private sector.
The provincial government says it'll force new doctors trained in Quebec to work in the public healthcare system for their first years of practice. Health Minister Christian Dubé announced he plans to table a new bill on this, and on Monday said that those who want to leave Quebec or work in the private system will face consequences.
We have to stop the hemorrhage. We have to bolster our public system. Educating physicians is costly and time-consuming. And I think young doctors have an obligation and responsibility to give back.
The government estimates it costs up to $790,000 to train a doctor, including during their residency. A medical student at l'Université de Montréal, who asked to remain anonymous for fear of hindering his residency applications, says the proposition is more of a political statement, that most of his peers end up in the public system to start off anyway.
In Quebec, we do have a great medical education, and our costs do stay low. So it is important to stay in the system and give back to the province, which gave us so much.
The government says there's been a 70% increase in the number of doctors working exclusively in the private system since 2020. But the med student says it may not be due to salary increases, but more about quality of life.
Many doctors who graduate, at least in family medicine, are forced either to work in areas that they otherwise wouldn't work in, or practice what we call IMPs or PREMs, which basically force you to go into fields of interest which actually don't stimulate you and are not your choice. And I think that just leads to overall unsatisfaction at work and maybe patient care that isn't ideal.
It's the responsibility of the government to make sure that there are opportunities and jobs, and that means PREMs. So you can't say to a young doctor, we insist that you work here, but we're not going to give you a license. It has to work both ways.
In a statement to City News, Dubé's office says, while too many Quebecers are still waiting to be taken care of, too many doctors decide at the beginning of their careers to leave the Quebec public network. We will take the means to give the population access to the care they pay for. This measure is part of a few other ways to strengthen our public network and attract our professionals to work there from the beginning of their careers. Currently, just over 3% of Quebec doctors work in private health care. Dubé has not said how long new doctors would have to remain in the public system or what consequences they could face.
If we all work together to find solutions to keep even that 3% of physicians in the public sector, and I think that's the ideal solution, instead of penalizing the ones who leave, who might have valid reasons for leaving.
In Montreal, Alyssia Rubertucci, City News.